Hello and welcome, Dr. Rob Kiltz and
Lisa Stack. Thank you for joining us.
Here at CNY Fertility for another webinar, and we're doing one a little early for the holidays. We're planning on taking the rest of the year off, but we've really enjoyed this, and we want to thank you for all the participation and keeping the questions coming. No question is too simple or stupid. Those are sometimes the ones I prefer, but really it's been amazing. And some people are talking about doing some small group parties at home to bring other people together and really share the process.
Absolutely. We absolutely encourage creating your own little pockets of a CNY Fertility family wherever you are, because I think many people are finding that, especially when they join our Facebook support group, where you can get tons of one-on-one support and information and sharing from over 300 of our clients. They're finding that there are quite a few women all over the world and close to them where they can meet up and share and get together and have that personal support as well. So if you're interested in joining the Facebook support group, you can contact me within the patient portal. Again, my name is Lisa Stack, or you can email me directly, lstack@cnyfertility.com, and I'm happy to add you to the group.
And since we don't live in small villages anymore, this is one way of connecting in those small village groups that help reduce the stress when you talk about your problems, and quite often it helps make this miracle happen.
Absolutely. So we have tons of questions we'll run through tonight. Send as many as you want. We try to get through as many as we can. The IVF giveaway webinar will be emailed directly by myself this evening, so keep an eye out for that. And if you have any questions after the session, you can always give us a call. You can connect with us through your portal or call us directly, and we're happy to help you.
And share with your friends or anyone that may not be a member of the Facebook support group.
Absolutely.
And
you can add them. Yep, you can add them to the group and really spread the word, because the more women we have on there, the greater the support is.
And really, this is a global approach because we're taking care of clients from around the world.
Absolutely.
And the more we learn, and I'm learning so much from people outside of the U.S., some new information, new ideas to help us on this journey.
Absolutely.
So, well, why don't we go ahead with the first question?
Sure. First question is, what causes eggs to degenerate after ICSI? I just had 3 disintegrate, and this has never happened to me before in 5 retrievals. Is it too much menopur a possible cause?
Well, the degeneration of eggs either prior to retrieval or after retrieval, and then at the time of actually adding sperm into the egg is not that common, but we believe that it's an inflammatory process within the follicle or the ovary that probably causes the damage to the egg. And then when you attempt to inject it with a needle, you cause that additional trauma that causes them to degenerate. And for some people, it may be the mixture of the gonadotropins, but the problem is that we've kind of have them all over the place. It's to use menopur, to not use menopur, to use LH in a 1-to-1 or a 2-to-1. It really, there's a lot of variety to that. We believe, and there was just an article actually from the journal from Brazil, Reproductive Biology Journal, that basically showed that no menopur or no LH was necessary, and the outcomes were the same either way. But we believe that it's an pelvic inflammation, ovarian inflammation, that causes the damage, and whether it's caused prior to the gonadotropins or during the gonadotropin stimulation, we don't really understand that very much. Another idea would to take those eggs and, rather than doing ICSI on them the next time, is just inseminate them and see whether or not there's a different factor on that. In general, we've kind of added ICSI as our standard, but it may be for some people that ICSI really is harmful. And much of what you can do here is really just look at how to approach all areas, reduce inflammation, change the gonadotropin amounts, and then try a natural insemination rather than the ICSI. That might be something to try on that.
Great. The next client retrieved 4 poor quality eggs and ended up with nothing to transfer. Do you advise taking a month off, or should she try again immediately? She's 44, so she prefers not to wait.
So age is a major factor on quality and quantity. And we've had this conversation with some of our docs and other clinicians on how to change the local inflammation. And one of the areas we're talking to everyone about is keto paleogenic diets, low-dose naltrexone, so reducing inflammation locally, yoga, acupuncture, massage, and maybe it's 30 to 60 days. Now, if you recently have gone through a cycle, it's a coin flip sometimes whether to go right into it or take a little time in between. And there's no straightforward answer. If you're feeling stressed and the holidays are an issue, then wait. If you feel like, boy, I'm excited, I want to keep on going, you may have done the human growth hormone recently, so you may have a little bit of that left over. It may be worthwhile going ahead and doing another cycle. Mix it up a little bit, eliminate the Menopur, and do straight gonadotropins and see if that helps. Add a little bit of letrozole, that may even help a little bit. And I've also gone to adding a combination of Neupogen, and in some people, the human growth hormone is not the way to go, and eliminate that and try the Neupogen instead. But I think, that conversation may be something we need to have in a little support in seeing you feel, whether or not to sort of jump into it. But at 44, time is an issue a little bit more, so I would say probably going at a little quicker than waiting.
Great. The next client has a physical job. She lifts 20 to 25 pound boxes all day long. Can this affect her IVF cycle in any way?
Well, lifting heavy things is a lot of cortisol and epinephrine, fight or flight. It's a stress on the body. So if you can find a way to sort of reduce that, it would be helpful. We sometimes help write some notes for people in the short course, whether or not they can have a change in job function that may be able to help them. I think that's important. It may be learning how to lift a little differently. Take a few more breaks and slow it down a little bit. Use that back in your legs, but try to do it that you're not losing your ability to breathe through the process. So I think heavy lifting, heavy exercise is stressful on the body, and it causes epinephrine, cortisol, and inflammation to go up. So slow it down a little bit.
Great. When pregnant, should supplements such as DHEA, vitamin D, fish oil, and CoQ10 be discontinued?
I think the vitamin D should be continued. The controversy, I think, is DHEA and CoQ10. I think in general we're dropping back. I don't know if I have enough information on the DHEA. There's always been a concern about excessive androgens, so I definitely cut that back. And the CoQ10 or ubiquinol, I think, really helps with mitochondrial function, and so I would say that is important during pregnancy.
Great. The next client is wondering whether her husband's low sperm count can affect their success rate.
Low sperm count absolutely can affect success rate, either with intercourse, IUI, or IVF. That said, IUI and IVF are helpful for low sperm counts and function. We do recommend a careful evaluation and treatment of both the male and the female because it's a 50-50 or 100%, both are contributing factors. Anything we can do to improve testicular function, reduce abdominal pelvic inflammation, so the ketogenic diet I think is real important. And of note, Aaron sent me a message from one of our clients that there was a male factor and they did the ketogenic diet and they're happy to say that after multiple miscarriages and failed IUI cycles, they're pregnant and it seems to be going very well and simply with the ketogenic diet. So I think it's an important thing that can help with those sperm abnormalities. And even when you have those sperm abnormalities, spontaneous pregnancies can happen. So low-dose naltrexone, ketogenic diet, reducing stress, reducing the exercise, I think, for both. And I think there's a lot of value to that.
Great. Speaking about the ketogenic diet, the next client is wondering whether it should be continued into pregnancy.
I believe the ketogenic diet is a lifetime plan. We've been working with Maria Emmerich, and she's got a lot of advice on that.
She
so
does.
if you go to her website and talk to her a little bit, she does some blogging, she does some personal coaching, and she just sent me a copy of her new book, the 30-day ketogenic cleanse. And the beauty of this, it has a lot of great recipes, a lot of variety, and we know that sometimes my take on it is a little bit more narrow, and T has always been telling me that I'm a little too boring on this, and I need to be a lot more creative. And Maria Emmerich has really come through.
She does, yeah.
And Maria is one of the people that I've learned a lot from. She has a book on ketogenic adaptation.
Yeah.
She worked with Jimmy Moore, William Davis, and a lot of others. So I think that if you
She's
work in
great.
that area, you'll find a lot of good benefit there.
Yep, she has some great, interesting information on breastfeeding while in the ketogenic diet, while pregnant, and then also she has great recipes, especially for the fat bombs that help you with those the sugar and carb cravings when you're transitioning. She has a lot of nice little tricks to help you really transition into this lifestyle, make it more adaptable.
And the mitochondria need fat for energy.
Yep.
And these diets and ketogenic diet really help in the quality of the fats that are getting to the mitochondria, reducing inflammation. And breast milk is a high fat meal. And so we know that babies grow well on that fat. And I've always said that the carb cravings are normal because it converts sugar to stored fat, and that's why women in general carry more fat, because it's important for growing babies.
Absolutely. The next client was diagnosed with MTHFR gene. Is this a concern for IVF?
MTHFR abnormalities or gene defects, I think, are important. For years, we've kind of poo-pooed them. I think the MTHFR gene defect has a lot to do with inflammation and blood clotting and folic acid metabolism. More and more, we're recommending folate or the actual active form of the folic acid is really important. I don't know. It's kind of interesting that many people that have this abnormality have children, and obviously the other side is true, but we've been recommending even adding aspirin and Lovenox and treating these a little more aggressively. And I think that this dietary methods of treatment are real important. So green leafy vegetables, which provide more folic acid and folate, are real important. And so, we don't have a straightforward answer, but I think if it's an abnormality that you're looking at, and we're looking at it more and more, you can't ignore it. And treating it is really important. So I always imagine that these microvascular spaces where the placenta is working to implant, if you have this defect and you have excessive clotting, you're blocking off the blood supply to the placenta, to the fetus, and that is a major factor in this.
Absolutely. For the next question, does everyone experience spotting after implantation occurs?
Everyone does not experience spotting after implantation, but it may be something that some people will experience. And I think that implantation spotting is another inflammatory reaction. So it's not a completely normal implantation site. It may be some of the attempted rejection that causes the bleeding, but the body may be strong enough to heal that area. So I always imagine that the immune system is there to both destroy and rebuild, because an embryo that's attempting to implant must first break down the endometrium to build the necessary connection, and then the body's immune system has to rebuild it. And so for some people that have a heightened inflammatory sort of imbalance of the immune system, maybe seeing that spotting early on. And I think that's where progesterone supplementation, LDN, baby aspirin, and Lovenox may be important factors in this process.
Great. How important is embryo grading? The next client is going to do her first frozen transfer next week, and she has one 4cc embryo and one 3cc, and she's feeling pretty discouraged.
Most people may know that I'm not a big fan of embryo grading because it's like grading a child in school that doesn't tell you what they're going to be like in the future. Interesting enough, if you take a picture of an embryo, it's only one stagnant point of time. And they're always changing quite quickly. And so I've seen so many CC embryos suddenly become AA embryos and expanded and beautiful. I had one patient that was texting me last week, and I looked at her day 3 embryos, and I thought, wow, these don't look so great. They're never going to become blasts. Now, I don't normally think that, but that was kind of part of me. I was a little worried about having to tell the next story. 2 days later, there were 2 amazing blasts that I too was even a little surprised about. So it always reminds me that our ability to look at any one moment is not very good. Every embryo that is frozen is a potential baby. And that's the one thing we need to hold on to. And I have one story of a mom that's always coming in. The babies, the little one's about 5 now, but every year she shows me the picture of the embryo that everyone said, piss poor, throw it out, start over, and it's now their son. And so I think our grading is too subjective and not scientific enough is my bias.
Great.
Have faith in your embryos.
Absolutely. Are frozen eggs as good as fresh eggs, or embryos?
So we're finding more and more that frozen embryos do as well or better than fresh embryos. So a fresh embryo transferred into a uterus that's had a heavy stimulation may be out of sync or may have other implantation defects that we don't understand. A minimal or natural stimulation and a fresh embryo may do as well as a frozen thawed embryo. So frozen embryos we're recommending more and more because now we could prepare the uterine lining so it's in sync, so they're lined up properly, and we're finding better and better success rates. So quite often if you had failed cycles, we're recommending a freeze-all. Or if you have a elevated progesterone at the time of the trigger shot, we're recommending a freeze-all. So a 1.5 or greater progesterone, we're recommending a freeze-all cycle and waiting until the next month and either doing a natural cycle and a frozen embryo transfer or doing a medicated protocol to try to improve your odds.
Great. In the days after an embryo transfer, should you have an orgasm? Does this help or hurt the chances of implantation?
So the question comes, is an orgasm helpful with implantation? And I'm beginning to believe that sperm in the vagina combined with orgasm may be beneficial. It helps set up the proper vasculature and immune response. And it may be just an orgasm as part of that. So a combination of orgasm with an ejaculation in the vagina or orgasm may be beneficial. The absolute answer isn't there. We used to say, really pelvic rest is the best, but we're finding it's not so. So that orgasm may be helpful in the day or 2 or 3 after embryo transfer.
Great. How does PGS improve IVF success rates, and what percentage does it improve it by? This client is 31 years old.
So PGS, or pre-implantation genetic screening or comprehensive chromosomal screening, or CCS, is where you have an embryo and you biopsy that embryo to identify the genetic competency of that embryo. It's controversial, to say the least. It's maybe more controversial in women in their late 30s and 40s. And Norm Gleicher has written some things on that. It helps in selecting the 1 or 2 embryos to transfer. It doesn't change the competency of that embryo. So if you're younger, 31, and you happen to have 8 to 10 embryos, and you're looking for that one embryo to transfer, it improves our ability to pick that one embryo and transfer it. And typically, we're biopsying the embryos and freezing them, and then we're selecting them out for that frozen thawed transfer. So really, it only improves our ability to pick the right embryo, doesn't improve the actual embryo. So it may reduce the number of transfers in order to get that better outcome, but it doesn't improve the embryo itself. I'm not particularly biased to that we should be pushing it because it's not 100% correct. We may have an embryo that says it's chromosomally abnormal, but it's a mosaic. The actual fetus or the embryo component that's destined to become the fetus may be normal in the process. So it's going to add some cost, but may not actually, and I don't think it improves that embryo itself, but it includes the cohort choice of those embryos.
Great. The next client's husband's vasectomy reversal in October 2015 was not successful. Should they try for a second reversal again and then do IUIs, or just go straight for IVF?
I would say if one time it's not successful for a vasectomy reversal, it's less likely to be successful the second time. You may have a heightened inflammatory response that's going to destined to cause it to break down a second time. But I think that's where Dr. Trussell would be a good person to talk to, our urology consultant within CNY Fertility. Talk to your doctor again and get that second opinion. But I'd say that IVF with a epididymal or testicular biopsy is probably the most reasonable approach to go and will offer you the best success.
Great. If you do have to do PGS testing, how long does it take for the egg transfer? What's the protocol timeline for that?
So typically for PGS testing, we'll do a stimulation, which takes about 2 weeks, and then you retrieve the eggs. You add sperm to the eggs, allow them to grow for 5, 6, or 7 days. So typically we're biopsying the embryos at blastocyst stage. The majority are becoming blasts at day 5 and day 6, and then we freeze them. It takes about a week to get the information, but basically it takes, you're able to do a frozen thawed transfer about 3 weeks later. So typically, you'll get a period a week after retrieval, 2 weeks of stimulation to prepare the uterus, and then a transfer about 5 days. So let's say 4 weeks afterwards would be about the earliest you can do a thaw and a transfer.
Great. If sperm has no motility, does that mean that it can't be used for IVF?
So no motility sperm doesn't mean non-functional sperm, because we know that some sperm that comes out of the testes or the epididymis may be non-motile, or in an ejaculate may be non-motile, but is viable sperm. And the only way to know is actually to inject it in an egg and see. So it's just ICSI, or intracytoplasmic sperm injection, allows us to pick the sperm and then to inject it into an egg to see whether or not it's going to be viable. There are actually some stains available that can be used to see if you have alive or dead sperm. And it may be worthwhile looking at that. If you do an ejaculate, do a stain, find out that there is some viable sperm. Unfortunately, we don't have the ability to know which one is viable in order to do that injection. And it really comes to a little bit of a randomness to pick those sperm. But that's where it may be worthwhile to do the ketogenic diet. We sometimes will add Clomid or HCG or LDN to try to boost the function of the sperm. And if that non-motile sperm is in the ejaculate, it may be worthwhile doing a core biopsy or an open biopsy to get the sperm where you might find more viable sperm, even though it's non-motile. So I highly recommend that as an option.
Great. The next client is wondering whether PCOS automatically means poor egg quality.
Polycystic ovarian syndrome, metabolic syndrome, is a cause of not ovulating and not conceiving and or miscarrying. There are women with PCOS that have children and didn't have a problem getting pregnant. And so for some, there's reduced quality of eggs and embryos and implantation and higher miscarriage rates. And for some, it doesn't seem to be that. And so really, it's still a matter of sort of a global approach to this. Inflammatory treatments, LDN, ketogenic, paleo diets, ovarian drilling, ovarian acupuncture, and laparoscopy can be very helpful for some who have failed LDN, letrozole, Clomid in the process. Some people absolutely will get some benefit to acupuncture, Maya massage, yoga, and persistence, and also metformin, glucophage. For those people who can tolerate, can be very helpful. But I think that sort of looking towards a global process and really treating the metabolic dysfunction is really important. We seem to think that that affects the androgen milieu in the ovary. And a colleague that I've been recently working with will do something called a removal of the ovarian cortex that removes a lot of those androgenic precursor cells, that reduces the androgens and reduces the inflammatory reactions in the ovary, and may help the egg quality and egg function tremendously.
Wonderful. So the next question is, do frozen embryo transfers have better success rates than fresh embryo transfers?
So getting back to, we always said fresh was best. We're finding more and more that a freeze-all cycle seems to be doing much better than fresh cycles. So if you failed in prior cycles, move on to frozen embryo transfers. Freeze-alls, either a cleavage stage embryos or blast embryos. Some people don't make blasts and they make really great cleavage stage embryos and look towards freezing earlier than later. Some people don't get pregnant because they froze early. See what you do. There's not a one-stop shop and one way to do for everyone here. And you have to be open to changing from what you've done in the past and stop the insanity. Let's be open to some new methods in this process.
Great. The next client was told that her prolactin levels are high and getting higher. Does this need to be addressed before starting treatment? She's already started her medications.
I think high prolactin levels need to be addressed, and whether it's empiric treatment with bromocriptine or Dostonex, Parladel, make sure with an MRI that you don't have a pituitary adenoma. Look towards medications, drugs. Breast stimulation causes it. And prolactin may have an adverse effect on the corpus luteum and either the progesterone production or the function of progesterone on the endometrium. So look towards some of those things in treating it. But empiric treatment with the Dostonex or the bromocriptine, I think, may be important enough. Look towards some non-traditional things. Acupuncture, yoga, meditation, stress reduction. Absolutely. I have someone recently that had a concussion, so we're not finding anything, but that may be a leading factor to some local inflammation that affects the pituitary hypothalamic function and the nerve endings that affect the neurons and the sending of the signals to the adrenals and to the ovary and to the uterus. It's all connected. It's all one. And some of it, it starts in our gut. It sends that signal up here and then sends it back down there. And so you have to really be open to some of these alternative treatments.
Great. So the next client is new to CNY Fertility, but not new to IVF. What can she do for anxiety? Her last clinic didn't allow any medications to help her manage it.
Anxiety for all of us is very common, and life seems to be an anxious experience. And that's why we've incorporated Eastern and Western medicine. We've talked a lot about the mind and the body connection. And for some people, it may mean some Zoloft or other anxiolytics can be helpful in the short term. And you need to talk to a therapist, a psychotherapist, a psychiatrist, or your primary care doctor that works with this. The use of naltrexone may be really helpful also. And so acupuncture, light therapy, and we're doing a lot of work with light therapy. And remember, always think about the auditory and the visual connections, which really, remember, we're geared to be anxious and frightened, I think. And so some people are a lot more sensitive to the verbal sound cues, the visual cues that trigger us. And so we don't know where these ancient things came in, but work on some massage and meditation and music therapy. And so, a lot of our centers, we try to pipe in some spa music, and I'm always putting on my phone some apps that help bring in some spa sounds. And, if you work on this at home, I've always, mindful meditation, start early in the morning, start the day with some 15 minutes of meditation, end the day with meditation, and find a really good book.
Absolutely.
Proverbs or mindfulness. It's really helpful, and work on that. But I'd say, I talked a lot about mindfulness. I talk a lot about food today, but I think integrating the two of them are the external resources or sources that affect the vibration in our body.
Absolutely.
And we can control it by changing our environment and changing our inputs, which are real helpful. And there's so many books out there on mindfulness. I highly recommend it. Shakti Gawain is really important. The 4 levels of healing, I highly recommend it. And but just Google mindfulness, and there's so many resources out there to slow it down.
Absolutely. And cutting down, we talk a lot about, especially when you're actively trying to conceive, a lot of time is spent on message boards and researching and looking for what could be the cause this time, what could be the cause the next time, or why hasn't this happened yet. So really working on putting the phone down, taking a big technology break. There actually are some really great apps that you can do that on your phone that track how much you're using it. How many times did you pick up your phone today? How long did you spend on Facebook? How long did you spend on Twitter or checking your email? So that awareness of how much time you're actually spending on your phone really encourages you to shut it down. And you can actually use some of them to set timers after 5 to 10 minutes to shut it off.
It's something I need to do. And I know for me, I've done painting and pottery and played the guitar and piano, and a lot of that work is because I'm attention deficit hyperactive, and by finding those things that I can participate in, it really is helpful in calming the mind. So find something to remove your distraction. And so knitting, sewing, crafting, and really those are really helpful things to calm the mind. It calms the energy in the body. And when you reduce the cortisol and epinephrine, these are the central core organs that are looking for that calmness to help the natural conception or assisted conception happen. And when women and men, but mostly women are talking to me, well, I got to run, I've got to do all these things because I got to calm the mind. It really is the opposite of where you want to go.
Absolutely. And when we had an interesting conversation at support group one time about making sure you have a sanctuary, especially in your home, making sure your bedroom is peaceful and decluttered and calm. And so when you get home at the end of the day, when you come back after a challenging appointment, maybe you had the results and it was negative, you have a nice calm sanctuary somewhere in your home that you can go to, and you sit there and you feel peaceful, you feel relaxed. It doesn't have a television, your phone is outside, maybe there's music or a candle or some books, but a bedroom, a living room, corner, someplace in your home where you feel at peace, where you can just unwind. It's very helpful.
And there's a lot on meditation and slowing it down, and it really does work. and it's a process and
Absolutely.
a practice. And wherever you're at, so the stress and things you're feeling are pretty natural and normal. And that's why that hobby and that quiet
Absolutely.
sanctuary is very important.
Great. Okay, next question. Let's see. Does acupuncture help with implantation? Is it advisable to do before a frozen transfer?
Acupuncture is very helpful if you can feel the stress reduction with the process. Some people can't. And that's where massage, I think, is really helpful.
Absolutely.
I was talking to a friend, colleague, that in Israel, acupuncture happens before, during, and after the transfer. So it's all going on at the same time. And so I think it really is important that you find the thing, and in our case, we believe that acupuncture and massage can be helpful.
Yes.
The problem with all these things is trying to prove it. And I can't prove it. I just know that as we add these other modalities and you find something that makes you feel calm in the process, let's add it.
Yeah, absolutely. The next client is wondering whether an estrogen priming cycle is okay for someone with bad endometriosis.
So endometriosis is a condition that is stimulated by estrogen, and bad endometriosis makes it even worse. And so one of the problems with endometriosis, it causes inflammation, and it may degrade egg function, egg quality, and numbers. So anytime you add the estrogen, you may be adversely affecting the endometriosis. One of the things we've been recommending is actually looking more to treat the inflammation, leave the estrogen out, and maybe utilize human growth hormone, a little bit of Humira, the intralipids, and the ketogenic diet. And so the estrogen priming is a common terminology we use, but we're adding more and more HGH, even some sub-Q Neupogen and Humira to add to the inflammatory modulation and improve the blood flow. So I think those are the things that we're looking towards more than anything. And IVIG may be another thing. Treating anything that reduces the inflammation in our bodies is going to help. And if you haven't had excisional therapy or even 3 months of Depo-Lupron, there may be some benefit to that to increase quality and quantity.
Great. The next client has had 3 failed IVFs, and as far as they know, they only have a male factor. Could it still be a female issue, or is it likely just to be the sperm? There's 3 failed fresh IVFs with only a known male factor.
Well, it's interesting because the sperm is normal, we call the guy normal, and then the woman's, everything's normal, but we're still blaming it on the woman's side. And so I think it is important to not negate either side in both important components. That you might be sort of focused on the guy because you found a problem, but you may be missing the subtle endometriosis or micro pelvic inflammation and adhesion or other metabolic diseases that aren't quite as obvious. Look at subtle thyroid problems. And so I'd say that you need to be looking at both sides, and this is where a diagnostic laparoscopy, hysteroscopy may come in, where you can treat the endometriosis or treat the mild scar tissue, or with the hysteroscopy, a DNC by cleaning things out can be really helpful. We've been recently adding a 2 to 4 week course of antibiotics for both, treating the hidden C, as we've been working with the group in Greece that's been testing menstrual flow, looking for hidden chlamydia. We think that the inflammatory diseases that we all carry between bacteria and yeast and other organisms are probably far greater than we ever imagined. So I would say that you need to look at both, even though you seem to be focused on one over the other. If it's failed implantation, good quality embryos, then absolutely look to treat more on the inflammatory immune side. We call it idiopathic, and I've always said idiopathic basically means we doctors are idiots and we're not looking at the whole picture, and we're just so focused on let's get everyone to IVF, and if we just put in more embryos and keep on going, we'll finally get there. And I always say insanity, you got to stop, look at the whole picture, and start the process over.
Great. So the next client, let's see, is 25 and has fibromyalgia and inflammatory arthritis. Have you ever had anyone do IVF that has had any of these conditions? She wants to try IVF in the next year or so and really wants to know, should she try it or not with these conditions on top of having PCOS? So fibro, inflammatory arthritis, and PCOS.
So I always try to keep things as simple, that there's a single cause to everything. And imagine that inflammation is the immune system that's dysfunctional, that happens to be causing a generalized fibromyalgia, some joint arthritis, but it's still systemic. And it may actually adversely affect the ovaries and cause metabolic polycystic ovarian syndrome. So it's probably all still an inflammatory vasculitis, and absolutely IVF may be reasonable, IUI, but I would always say you got to look towards treating the immune system. And I was talking to a gastroenterologist, a general surgeon that does a lot of bypass surgery to help obesity. And a lot of this is still, the gut is the source of the majority of inflammation. And that's where ketogenic and paleogenic diets really come in, and talk to someone about that and look at that as a treatment option and treat the inflammation. It's going to help you whether you're proceeding with IVF or not, but certainly I think those are important factors in this.
Great. The next client has premature ovarian failure with an AMH of 0.2 and an FSH of 118. Is there anything you would consider trying to stimulate ovulation and use her own eggs and then hope to do IVF? Or would you recommend, sadly, for her going straight to donor eggs? So, premature ovarian failure, AMH
Age.
of 0.2, doesn't say age.
So a high FSH and a low AMH, menopause, although for some women in premature ovarian failure, premature menopause, especially if you're younger than 35, some women will actually regress and improve and go into natural ovulation. I think the culprit still goes back to the immune system that may be causing antibodies that block the ovarian function, although none of this has really been well proven, but we've had cases where we may put on the birth control pill for 3 to 6 months and immediately go into high-dose gonadotropin stimulation and see whether or not we're going to get any ovulation stimulation after this. I know I had one gal a number of years ago that had a very similar story, and I was like, there's no way you're getting pregnant, and her story was, absolutely, I'm going to get pregnant. We did high-dose gonadotropins, nothing happened. Like a month later, she's pregnant after we did that, and she went on to have 3 more babies because, in fact, she wasn't in menopause. She had intermittent ovarian failure, probably due to autoimmune condition that we don't know whether it was dietary or stress-related or other environmental factors. But those are some things to work on, including acupuncture and myomassage, and look towards that. But in general, that's where donor eggs are going to come in to give you your best odds of success.
Great.
But interesting enough, certain parts around the world, they're beginning to look at ovarian transplants and even taking donor ovarian tissue and transplanting into your ovaries that may help your ovarian function kick in.
Great. The next client is a 43-year-old, very active female. She's wondering if she does have to take hormones if she goes forward with the process, likely an IVF process. She doesn't drink or smoke, and she's not crazy about taking any medications or hormones.
Well, at any age, you can attempt a natural cycle or minimal stimulation with Clomid or letrozole, and there's actually a lot more evidence coming in that Clomid letrozole in that age group may work as well, because the high dose stimulation typically doesn't make many more eggs. And so by doing a letrozole Clomid low dose stimulation or a natural cycle and see what you get out of that, and then doing a freeze-all or a fresh transfer is reasonable. I always say, it's do it or not, there be no try. So you have to do something to see what happens. Sometimes we think and wonder, but the only way to know is to do it and try that thing that you're interested in, because I can never say it will or won't work. I might be able to give a probability of more likely, less likely, but I've seen miracles and I've been surprised many a time in my many years of doing this. So
that's great. The next client will be traveling to us. What is your recommendation on mode of travel after retrieval, flying or driving?
So really there's no restrictions on flying or driving, pre or post. We are seeing clients from around the world. Medical tourism in upstate New York is easy to get here.
Absolutely.
And the snow for most doesn't stop us. The plows are active and we're used to it. But really getting to upstate New York is easy, and we want to make the process easy for you. And Lisa talks to a lot of people. Our support person, Erin, helps a lot also. And any questions on that, but really from the transfer, we sometimes recommend a little bit of rest, but the studies show you can get up and you can travel, and really there's no restrictions. And we're in constant communication day by day to help you and guide you through the process.
Absolutely. And lots of girls on our Facebook support group can make recommendations of places that they loved staying at, things they did while they were here, favorite restaurants, and just tips and tricks, especially getting on the airplane with your medications. How are they packing it? How did they feel going through security? There's people sharing their stories all the time.
Well, it's interesting because many of the people at the Syracuse airport know us and know our clients. And we've been working with the Maplewood Inn and the Genesee Grand. They'll pick you up and they'll drop you off. You don't have to drive. They'll take you to the airport and pick you up from the airport. So really it's about making the whole process easier. And I would say that the cost structure that we have allows people not to have to travel to Czechoslovakia and make it a lot easier. So that's really been something we've been working on for years. And I think the affordability is key, but quality, and we're always interested in what was your experience like, how we can improve things. We recently had a patient that went back to their doctor, felt very confused. The doctor picked up the phone, let us know the problem. We were able to immediately talk to the client, help guide them through the process and make it better.
Absolutely.
And so we know that we humans are never perfect, but we want to work on the process and be better for each of our clients.
Absolutely. So do we have to have bed rest after an embryo transfer? The next client has a field job where she has to carry a 10 to 15 pound backpack and walk flights of stairs. Should she take a few days off of work after the transfer?
If it's going to make you feel stressed, yes. But ultimately, there's no evidence that resting or going back to your normal activities matters very much. And so whatever you're doing, caring, working, do it mindfully and be positive about your growing life form in that beautiful vessel.
Absolutely. Is there anything that you would recommend the male clients to take to improve the quality of sperm with low morphology? So
one is work on the general body inflammation by the keto, paleo diets, LDN, meditation, massage. All those things are really valuable. Theralogics.com is a partner of ours that works on lots of really high quality antioxidants. And Dr. Trussell has done some work with them in looking at the beneficial effects of these. And certainly for men, look at thyroid, prolactin, look at vitamin D, CoQ10, fish oil, all important things to improve the quality of their overall health, gut health, and local pelvic, prostatic, seminal vessel, testicular health is really, really important. And for some guys, we might find in an ultrasound or exam a varicocele, and fixing that varicocele can be very valuable. And then for other guys, we're maybe adding some Clomid, letrozole, or HCG supplement to help boost those effects. And
Great.
so really look towards a global approach. And, you know, Dr. Google can be helpful. Don't spend an arm and a leg out there. Really look towards some natural and more sane things in the process.
Great. The next client has had a terrible stomach flu with vomiting and diarrhea in the middle of her cycle. Do you think this could negatively affect the outcome?
It can, and you know, any total body inflammation can be very stressful. You know, it may be a matter of staying well hydrated. Sometimes actually not eating. And if you look at Jason Fung's recent book with Jimmy Moore on fasting, you know, IV fluids and really can be helpful in this. And that might be helpful to kind of clear the gut. It's a cleansing process, and you're going to have to see in the process. And sometimes it's a matter of, you know what, I'm not feeling great, and let's hold back and kind of go from there. And we want to help coach you along the way. And
Absolutely.
sometimes we wind up doing a retrieval and we look back at it and say, you know what, not the right thing. And then we figure out what do we need to do to help on all sides get you to the next level.
Absolutely. How does PGS improve IVF success rates? And the next client is 31 years old, so what odds of improvement do you think she has by using PGS?
Well, I think we talked a little bit about that already. Really, PGS allows us to choose the best embryos for transfer versus randomly getting an embryo that might have a 50% of chromosomally being abnormal and not implanting. So that's really the area of PGS, is a selection of the right embryo. And more we offer it for everyone. But it may or may not be the reasonable thing to add to the cost in the process.
Absolutely. The next client's husband had prostatitis right before they found out he had a varicocele and oligospermia. She read that this kind of infection can permanently affect sperm. Is that true, or is it more likely to be from the varicocele?
Well, prostatitis is an inflammation of the prostate, which can typically acutely affect the sperm and the natural anatomy that may have a long-term effect. But aggressively treating the prostatitis with 2 to 4 weeks of antibiotics and maybe repetitive treatments may be important. Treating both partners, I think, is really important. And in general, I would say that you should get improvement with those types of treatments, along with looking at sort of that global reduction in inflammation, should help improve the sperm, but it may take 3 to 6 months of that type of treatment to improve the sperm function. We've been recently looking at the idea that, again, these chronic infections being passing back and forth, and remember that the body is highly susceptible to inflammation. And I believe our high carbohydrate glucose environment is just a feeding frenzy for bacteria and yeast and other organisms. And so that's the beauty of high ketogenic diet, high fat, low carbs, will really help the body's ability to mount a really great response. And don't forget, look at low dose naltrexone. And as you read, there's a couple of books out there on it. And check out Phil Boyle. He's in Ireland. He's been using it for years, and I think it's really another approach to look at.
Wonderful. The next client is 29 years old and has done 1 IUI and 1 IVF, and neither took. She was told that her eggs didn't mature enough while doing the IVF medications. She hasn't tried a second round, but was wondering, should they try to be less aggressive with the medications or more aggressive in the next time?
Well, if you are more aggressive, look towards less aggressive, and always step back and look for endometriosis, laparoscopy, hysteroscopy, and then look towards either Neupogen or human growth hormone in the process, and it may be adding more LH or less LH. you want to try something different. Go a little bit earlier or go a little bit later. It's an interesting part when we talk about poor maturity. Our ability to know whether or not it was pre or post mature isn't very good.
Yes.
And you just got to mix up the medications and the process, add a little bit of the traditional Chinese medicine approach, that very ancient approach that may help in the process. And so if you're using Lupron only as a trigger, add some HCG to the process. Do a double trigger and may help in the process. And then be prepared to look at in vitro maturation, because we do have some techniques that may help with in vitro maturation in the process. But I know I've had some people with standard stimulation go right to a natural cycle with no medications, and we did better on that than we did with the stimulated cycle. So be open to the process. And as you'll see out there, there are so many opinions, it's hard to know which is the right one. And I always say, if what you're doing isn't working, you have to work to provide and practice something different.
Absolutely. And if at any point anyone is feeling like they're at a crossroads or they need to make a change, you can always schedule a follow-up talk with one of our physicians or nurse practitioners, and it's a great opportunity to just be on the phone with them or in person with your chart open and say, let's take a look at what we did the last few cycles, what worked, what didn't work, and what should we change going forward or stick with. So that's a nice thing that you can do.
And again, we've been really, really open to, we do a lot of free video consults, FaceTime, Skype, and just simple phone.
Absolutely.
And just the conversation, I think, is really, really helpful.
It is. Do you recommend ordering medications from overseas to save money?
There are lots of places in this world to order medications. I don't know the right place. It's a global economy, and these same companies make them all around the world.
Great. So let's see. How will stage 3 or 4 endometriosis affect IVF egg retrieval and implantation rates? She just had a laparoscopy to remove a persistent cyst, and they found endo. She's 43 with an AMH of 4.8.
Wow, that AMH of 4.8 is wonderful. And the inflammation from endometriosis, whether it's in the ovary or just lining the pelvis, can affect implantation and or egg quality. Excision of the endometriosis and ablation in some areas, I think, is helpful. And then treating the immune system, and then do that stimulation, make the embryos and freeze them, and then go back and treat the endometriosis more aggressively, try to reduce the inflammation, and then do the transfer.
Great. The next client is considering allowing natural insemination of sperm as opposed to ICSI. If the sperm doesn't make it into the egg, can ICSI then be done, or as a last resort, or is it too late after that period?
Well, if we don't see fertilization after the first day of adding sperm, we do something called rescue ICSI, where we add the sperm the next day. It's not as successful as the one. We used to be, before we had ICSI, we just add a drop of sperm and see what happens. And then we've kind of been on this curve of ICSI for everyone. And my bet is we're going to start kind of coming back to standard insemination more and more, and looking at that option. We've actually been looking at a new device where we do a vaginal culture of embryos, where we add a few eggs, some sperm placed in the vagina for a culture method, and so we'll be doing less and less ICSI if we look to incorporate that in the process. So we're looking at these areas, but I'd say that a cycle, even some eggs where you don't inject sperm, where you might inject in some and not others, like 50-50, might be a good approach to the process.
Great. What would you recommend for a vegan with the ketogenic diet?
There are some ketogenic vegan approaches. This is where a fasting process may be more in line. So you eat one meal a day, you convert the sugar into fat, you go into ketosis by morning, and that may be one approach. But Diet Doctor Maria Emmerich has some advice on that. I highly recommend looking at dietdoctor.com, ketogenicdietresources.com, and Maria Emmerich's website and information can be really helpful. But adding butter fat, eggs for some, and more coconut oil may be an approach there to the process.
Absolutely. Now, we've had a few questions about whether this can be viewed later, and all of our webinars are recorded. This will be uploaded within the week, and you can view it. Reaching our homepage, if you go to watch our TV, you'll be able to see all of our webinars from the past and all of our previously recorded videos. It will also be posted on our Facebook page once it's been uploaded, so you will have access to this, absolutely.
And we really wish we could answer all your questions at once, and you just keep them coming. And we're really excited about the new year to continue high quality, affordable care, and whether it's IVF or natural fertility. Again, our job is to help educate you with some ideas that are going to help you conceive in every method possible.
Absolutely.
And this is really a global family. It's a small village, and this conversation, I think, is really helpful. And I just really want to thank you. The best in the holidays. Take some time to take care of yourself. If you're not taking care of yourself first, then it's really a hard one to try to take care of anyone else. And support group and individual support. And thanks to Brad for helping us in the back end here. And again, thanks to everyone for the support. My dad recently passed. I've gotten so many really great condolences and support. 92, mom died, passed early this year, 92. A great full life. And I feel so blessed to have such a great family in our CNY Fertility, CNY Healing Arts family globally. And thank you.
Thank you.
God bless.